My name is Lila Rose, and I'm the president of Live Action. And we're so pleased to have with us today Dr. Anthony Levatino. Dr. Levatino is a board-certified obstetrician-gynecologist from Las Cruces, New Mexico. Dr. Levatino is here with us to share his powerful story of his transformation from a doctor who performed over 1,200 abortions to now a leading pro-life advocate. Dr. Levatino, thank you for being with us.
I'm happy to be here, Lila.
Can you tell me why you first were performing abortions?
I graduated from medical school in 1976 in upstate New York, and if you asked me at the time how I felt about the abortion issue, I wouldn't have hesitated for a minute to tell you that I was pro-choice. This was a choice between a doctor, that female patient, and no one, including the baby's father, really had anything to say about it. You know, some people identify themselves as pro-life or pro-choice, but for so many people it doesn't affect their lives directly. But when you're an obstetrician-gynecologist and you say you're pro-choice, it becomes a very personal decision. You have to decide whether you're going to actually do abortions. So along with learning how to do deliveries, hysterectomies, and everything else obstetrician-gynecologists do, I learned to do abortions.
So you saw it as a part of your practice?
Absolutely.
During the time of performing abortions, did you ever have any doubts?
The first doubts that I had about doing abortions happened during my residency training. When we were doing first trimester suction D&C abortions, interestingly enough, in the delivery room, and when it was my turn to do them, I would do 2, 3, 4 in the morning, never thought anything of it. And we were doing late-term abortions in the form of saline abortions at the time. Technology was different. I met my wife, and we married, and like a lot of young couples, we wanted to have children, and found out very quickly that we had an infertility problem and that she just wasn't getting pregnant. She went to the best infertility specialist in town, and it didn't look like we were going to be able to have children of our own. So after we got over that shock, we decided to adopt a child. Now, anyone who's tried to do that knows how very difficult that is. We went to county agencies, state agencies, religious agencies, anyone we could think of to find a child to adopt and care for as our own. It was during that time that we were trying to adopt a child that I had my first doubts. They were strictly selfish ones, but they were there. I remember literally, I very vividly remember being in the delivery room one day doing a suction D&C abortion and thinking, my gosh, I'm throwing this kid in the garbage, and here I am trying to adopt a baby, yet I'm throwing them away, and I'm smart enough to know it's people like me that makes adoption so difficult in the first place. So the initial doubts that I had were very selfish ones, but they were there.
What did you do when those doubts came and you were searching to overcome the infertility and find a child to adopt? What did you do to kind of put away those doubts when you were performing abortions?
Soldiered on, kept on doing my job, and at the same time tried very hard to find a baby to adopt. We literally started to advertise. I talked to every obstetrician-gynecologist in town and people at the hospital and everywhere else and let them know that we were looking for a child to adopt. In August of 1978, I remember very vividly, I was working in the operating room with one of the attending physicians, and the circulating nurse tapped me on the shoulder, and when I turned around, she was holding up a little piece of paper that said, "Call Marcia as soon as you're done." Now, Marcia was the head of social services at the hospital where I was working, and she's one of the people we had talked to. That's all the note said, but I knew what it was. And sure enough, she informed me that there was a 15-year-old girl in labor in the delivery room. She had showed up at a doctor's office for the first time during her pregnancy the day before. Now she was in labor. She wants to give her baby up for adoption. Are you interested? Amazing. She told me over the phone, and I was like, well, of course I'm interested. I remember literally staring at the face of that telephone to call my wife with this news and know that I was just 7 digits away from becoming a father.
Beautiful.
And literally, by the grace of God, we were able to adopt a little girl that we named Heather in August of 1978. And my wife got pregnant the very next month. And we had 2 children. Exactly. We ended up with 2 children, a son and a daughter. They were 10 months apart. Our son Sean was born in July 1979.
Amazing. So can you share more? You've adopted Heather and the events that led to that transformation where you ultimately completely rejected abortion. What was it that really changed your perspective?
I was doing abortions on a regular basis in my practice, and everything was just, the kids are growing, and I'm starting to make some money finally, and everything was just wonderful as far as I was concerned until June 23rd of 1984. June 23rd, 1984 was an absolutely beautiful day in Albany. Heather was exactly 2 months away from her 6th birthday. We took the kids to an amusement park that day, came home, we had dinner together, and the kids were playing in the backyard when we had friends arrive for cake and coffee. We were talking with those friends when at 7:25 that night we heard the screech of brakes out in front of our house. The kids had wandered into the road and Heather had been hit by a car. She was a mess. You know, I'm a doctor. I'm supposed to be able to save people's lives. My wife was an intensive care nurse at the time. This is what we did for a living. This was routine to us. But it made absolutely no difference, and she literally died in our arms in the back of an ambulance that night. You know, people who are listening who have children may think they have some idea of what that feels like. I guarantee you, if you haven't been through that yourself, you have no idea what it feels like. I pray you never find out. But what do you do after a disaster? You know, you bury your child and take some time off, and then you try to get back into your life. And I don't remember exactly how long it was after Heather died that I did my first D&E abortion, but I showed up at OR number 9 at Albany Medical Center just like I had over 100 times before. I wasn't thinking of this as anything special. This was routine to me, and I obviously had other things on my mind. And I started that abortion and put in what's called a Sofer clamp and literally ripped out a baby's arm or leg that big, and I just stared at it in the clamp. I got sick. I mean, I literally got sick. But when you start an abortion, you can't stop. When you do a D&E abortion, you have to keep inventory. You have to make sure you get 2 arms and 2 legs and all the pieces. Because if you don't, your patient's going to come back infected, bleeding, or dead. So I finished that abortion. I soldiered on and got it done. But I looked. I really, for the first time in my career, really looked at that pile of baby parts sitting on a table. And I didn't see all those things that had sustained me all those years. I didn't see what a wonderful doctor I was helping her with her problem, and I didn't see her wonderful right to choose, and I didn't even see the $800 cash I just made in 15 minutes. All I could see was somebody's son or daughter. And suddenly this was looking really different to me. For the first time in my life, it hit me very powerfully that this woman had come to me, figuratively, not literally, no woman ever literally says this, but figuratively she came to me and said, here's $800, kill my baby. And I was the kind of person that would look right back at her perfectly calmly and say, why sure, I'll do that.
After having that encounter and seeing that child and seeing it as a child, what was the process like to stop advertising for abortion?
Well, I didn't stop right away. I did a couple more, but these were just, I mean, I knew why I felt bad. I will get over this, but I didn't. A change had come that I couldn't take back.
So you tried to do a couple more to see maybe I can get over this, but you couldn't.
Exactly. So I went to my partners and I announced that I would no longer do second trimester D&E abortions. They were just too difficult. And there were just 2 of us in the group that were doing them. So and this dumped the entire load on the other partner. But they knew what was going on. They understood. And I told them I would only do the little ones, the first trimester suction D&C abortions we were doing in the office. And for a couple more months, I soldiered on doing those. But a change, as I said earlier, had come that I couldn't take back. When you finally figure out here, not here, that killing a baby that big for money is wrong, that it doesn't take you too long to figure out it doesn't matter if the baby is this big or this big or this big or maybe even this big, it's all the same. And I'm ashamed to say it, but it was February of 1985, it was that late after Heather's death, that I went to my partners a second time and said, I will no longer do any more abortions. And I haven't done any since then, and I never will.
One of the biggest arguments of pro-abortion activists is that abortion is medically necessary. What's your position on that?
We hear all the time how abortion, including especially late-term abortion, is necessary to save women's lives. Nothing could be further from the truth. I spent 9 years working at a tertiary medical center. I mean, there are only certain hospitals in the country that are designated to take care of the really, really high-risk pregnancies. You don't want to duplicate the effort, it's expensive. So these hospitals get referrals from the surrounding area. And Albany Medical Center in Albany, New York, where I worked, was one of them. I was faculty at the hospital for 9 years. And I saw hundreds of cases of really severe pregnancy complications, cancers, heart disease, intractable diabetes out of control, toxemia of pregnancy out of control. And I saved, in those 9 years, I saved hundreds of women from life-threatening pregnancies. And I did that by delivering them, by ending their pregnancy by delivery, either induction of labor or cesarean section.
Delivering the baby.
Delivering the baby. And I always tell people, in all of those years, the number of babies that I was obligated to deliberately kill in the process was zero, none. And I'll give you an example. The key point about late-term abortion that so many people miss is that it takes days to prepare the cervix. This is not a natural situation by any stretch. If you're going to dilate a cervix sufficiently, that starts off essentially as a pinpoint, large enough to dismember or tear apart a baby this big, that cervix has to be dilated, and that can take anywhere from 24 to 72 hours. And especially when you're talking about later-term pregnancies. Most life-threatening situations, the vast, vast majority of life-threatening situations in pregnancy are not going to arise until 24, 25, 26 weeks of pregnancy and higher. And when you're talking about that, you're talking about abortion procedures that take 2 and 3 days to prepare the cervix. And I'll give you a classic example. This is a real case. A lady came to the hospital at 27 weeks of pregnancy with severe toxemia. Her blood pressure, you know, a normal blood pressure is about 120 over 80. Her blood pressure was 220 over 160. Okay, this lady would literally be minutes or hours away from a stroke. What do you do in a situation like that? We stabilized her, brought her back, did a cesarean section, had her delivered within an hour of arriving at the hospital. She and her baby did just fine.
Amazing.
Now, let's say we wanted to use abortion to save her life, okay? If with that kind of blood pressure and that kind of problem, if we waited 2 to 3 days to get her cervix prepared, she would never make it. She would have been dead. And that's a perfect example. You never need late-term abortion to save a woman's life. If necessary, you accomplish the delivery. Now, did every one of those children make it because they were preterm? No. But they all had a chance, and most of them did make it.
What you're saying is so amazing, Dr. Levatino, because a lot of people never hear this. They assume when abortion is brought up that it's necessary to kill that child, sometimes to save the mother's life. But you're saying it may be necessary to deliver the baby, but you never have to purposely go and kill that child.
That's exactly what I'm saying.
So why is this such a huge argument for pro-abortion advocates to say it's necessary to kill to save the life of the mother?
That argument I don't understand. In my experience over almost a decade, I never had to kill deliberately a single child to save a woman's life during pregnancy. There's a wider discussion, though. Politically, always listen very carefully to the words that are being used. You know, we need to pass law X, Y, and Z because it protects women's health. Bill Clinton, I will be happy to sign a ban on partial birth abortion so long as it includes an exception on women's health. Well, what do they mean? Now, I have a law degree, and every lawyer knows that every single word has meaning. And what Roe didn't do was define the word health. Doe versus Bolton did. It says that health, the term health, includes a woman's physical health. Okay. But it didn't say how badly impaired her physical health had to be for it to be a problem. It includes her mental health. Okay, but again, how bad does her mental health has to be? I suppose I can imagine, I never saw one, but I can imagine a case of if the woman's going to have a psychotic break because of her pregnancy, that certainly seems like a severe mental health problem. How about she's under tremendous stress? How about, I just don't think I can cope with this pregnancy? That's mental health too. It includes her economic health. Whoa, How much money do you have to be economically healthy? Not defined. And if that wasn't enough, it includes her social health. What in blazes does that mean? What it means then when a politician says, I would be happy to support your bill so long as it has a health exception, translation, I would be happy to support your bill so long as it contains an exception so big that the bill is of no real practical effect.
In recent years, RU486 and medical abortions have been really pushed on women. What do you think about RU486?
The short answer to that question is I can't understand why any woman would want to have a medical abortion, and I'll explain why. No matter how abortion-minded she is. There are a lot of problems with RU486. First off, a medical abortion is very distinctly different from a surgical abortion. In a medical abortion, the lady takes pills, takes her RU486 medication, and then follows it up with a second medication, typically one called Cytotec, 24 to 48 hours later. It has a significant percentage of side effects associated with it. That combination is well known to cause cramping, hemorrhaging, nausea, vomiting, and a lot of extremely unpleasant symptoms. The really interesting thing about it, though, is RU486 is FDA approved up to 7 weeks from last period. It is commonly used off-label to 9 weeks. Okay. But even at 7 weeks of gestation, the failure rate was 5% at 7 weeks. As gestation gets further along, the failure rate increases. At 8 weeks, the failure rate is 8%. At 9 weeks, the failure rate is 10%. Imagine, you're going to go through the trouble of having this abortion. You're going to go through a significant percentage of patients will go through a lot of very unpleasant symptoms, and the abortion won't even work. And then you end up with a surgical suction D&C abortion that you could have had in the first place.
And are there other health problems or along the way as well, as far
Very
as
definitely.
having a failure rate?
There's one huge difference between a surgical and a medical abortion. When you do a surgical abortion, you have tissue, you have baby parts, you have all the contents of the uterus. And if the doctor is doing what the doctor is supposed to do, sends off that tissue to be looked at by a pathologist, who will then confirm whether or not there is pregnancy tissue, products of conception, in that specimen. You do a D&C abortion, you get back a pathology report that says there are products of conception present, you're good. You've done the procedure, you've done it correctly. In a medical abortion, there is no tissue to be examined. That woman essentially pays that money and goes through this procedure to have an induced miscarriage, which can happen at home, in her car, or anywhere else. But there is no tissue to be examined. The key there then becomes when a surgical abortion is done and no products of conception is seen, it means either the doctor missed the pregnancy entirely, which can happen, not very often, but it can, or more frequently, she has a tubular ectopic pregnancy, and that can be fatal.
Can you explain more the danger for a woman who may have an ectopic pregnancy if she's seeking an RU486 abortion?
You must rule out an ectopic pregnancy. But the only way to rule out an ectopic pregnancy, if you're going to use RU486, is to do an ultrasound. And not everyone prescribing RU486 is getting ultrasounds. There have been deaths associated with RU486, mostly from infections or undiagnosed ectopic pregnancy. Ectopic pregnancy can kill you in no time flat because a pregnancy was never meant to be in a fallopian tube, and it can only go so far before that tube ruptures, and hemorrhage, sometimes severe hemorrhage, follows.
Another reason or justification pro-abortion advocates use for abortion on demand in America is that it's necessary because of ectopic pregnancies.
That's rubbish. Ectopic pregnancies are life-threatening. Treating an ectopic pregnancy is not doing an abortion. It is saving that woman's life. It's that simple.
While you were practicing as an abortion doctor, while you were performing abortions, did you ever come across pro-lifers, and what was your perspective on pro-lifers?
People always ask that. Now understand, as I tell people, I was not running an abortion clinic. I was running a regular OBGYN office like most women have gone to. We did deliveries, we did hysterectomies. Abortion certainly was a part of our practice. And it was during those 3 years before I stopped doing abortions in that private practice that I arrived at my office one day and there were picketers surrounding our building, praying, holding their signs. They didn't have our names on the signs, but we knew they were there for us. And people frequently ask me, what are you thinking when we're outside picketing? And I would tell them what we were thinking, what you're thinking when you're in that situation. It gave us a siege mentality. It was us against those kooks outside.
And when you saw folks outside, where did you get the stereotype that they were kooks?
Everybody in the pro-abortion, every abortionist knows that everyone, involved in the pro-life movement is a kook. I mean, CNN tells me so. They would never lie to me.
Do you remember any kind of exchanges that you had with pro-life advocates?
I remember very vividly an exchange, but it didn't happen quite the way you might imagine. It was during that time when a woman came to me as a new patient. Her name was Susan, didn't even come up to my shoulders. Came in for a routine OBGYN appointment, OBGYN annual exam and a pap smear. Did her exam, and then at the end of the exam, she looked at me and said, "Can I talk to you?" Now, doctors know that many patients, I think especially women, won't really tell you what's on their mind until they've established some level of trust. And so it wasn't all that unusual that she did that. And so I sat down in my office and looked at her and professionally looked at her and said, "Ma'am, how can I help you?" And she absolutely blew me away when she said, I've been sent here to give you a message that Jesus loves you. He cares about you. This is not what he had intended for your life, to be an abortionist. Please stop." Now, I had one overwhelming thought when she said that, and that was, I've got to hustle this kook out of my office as fast as I could, and I did. A year later, she showed up for her routine annual exam and pap smear. And when the exam was over, she said, "Can I talk to you?" And I went, "Oh, no." Now, understand, it's not like I never darkened the inside of a church before, but people who were really demonstrative about their faith really made me uncomfortable. And she basically said the same message, more or less. I've been sent here to give you a message that Jesus loves you. He cares about you. This is not what he intended for your life, to be an abortionist. Please stop. Now, believe me, I remembered what she had said the year before. But in the intervening year between those 2 visits, I received at least 3 personal greeting cards sent to the office, to me, marked confidential, with the message written on the card. One time during that intervening year, I arrived in my office and there was a plate of brownies sitting on my desk with the message tied to the brownies. It's funny, I wouldn't have put a name or a title to what had going on, but Joe Scheidler of the Pro-Life Action League, who's written several books, calls that adopting an abortionist. And that's exactly what this woman did. Now, it's really interesting. It was not till much later that I realized, that I found out, that she was one of the people picketing my office. And I have a message for people, especially for women. "Oh, Dr. X does abortions. I would never go to him." Well, you're never going to change somebody's mind you can picket all you want. You may or may not change somebody's mind that way, but I will suggest to you that most of the time you won't. And you can yell at someone and scream at them, but I can absolutely tell you, you will not convince their mind about anything that way. If you're going to convince somebody that maybe the path they're walking is wrong, you need a relationship with that person of some sort to be able to start that dialogue. This lady was very clever. She became a patient. Believe me, doctors listen to their patients.
It's amazing, and definitely a message to women who are pro-life that maybe that doctor that is performing abortions is one to go talk to.
Exactly.
Dr. Levatino, thank you so much for being with us today.
My pleasure. Thank you for having me.